Hello everyone. Today we are going to see the enzymes which are used in pharmaceuticals. Okay. So what type of enzymes are used in pharmacy? Okay. So what happened? There is a more than 700 enzymes are estimated which is occur in nature. Around that 100 have a industrial relevance. Okay, and the value which is added with the help of that enzyme is many times greater than the primary value. They are very important in analysis and the diagnostic purposes. Okay, so there are various approaches are available which can be used in pharmaceutical. Okay, so these pharmaceutical enzymes, it is also known as a therapeutic enzymes because it is used in one of the therapy, or it is also known as a application which is having in biomedicals. Okay, so for the synthesis of new antimicrobial compounds. Okay, then afterwards in the enzyme replacement therapy, in the treatment of cancer, in graft and dermatological applications. Then it is also some enzymes, it is used as an activator of some certain precursor molecules. Okay, and it prevent the dental cavities. So there are various biomedical or the pharmaceutical enzymes it is available. Okay, so pharmaceutically important enzymes are the important component of pharmaceutical market. They are broadly defined as a prodrug. Okay, as it is used as a in pharmacy, they are called as a prodrugs, and these prodrugs that target a specific biological reversible or irreversible reaction to treat a particular diseases. So these enzymes, they are used to treat a particular disease. So the microorganisms are the major source of pharmaceutically important enzymes, but several enzymes are also obtained from animal and the renewable plant sources. So it is not like that only the microorganism, it is used in or microorganism, it is a source for pharmaceutical important enzyme, but sometimes the animal and their plant source are also used to use as a pharmaceutical enzyme. So what are the enzymes which are used in pharmaceutical? Okay, so the enzymes which are used in pharmaceutical application, it include cysteine proteinase, asparaginase, streptokinase, urokinase, deoxyribonuclease, hyaluronidase, pega-DMase, glucocerebrosidase. So these are the various enzymes which are used in pharmaceutical application. So maybe MCQ asks like that, what are the following enzymes used in pharmaceutical application? Streptokinase, amylase, okay, then sucrase, maltase. So your answer is what? The streptokinase. So even immobilized enzymes are also used in pharmaceutical industry. So what are the sources of that pharmaceutical enzymes? Like animal source, plant source, microbial source. In microbial source, again the bacterial sources and the fungal sources are available. Okay, so afterwards, that is the what are the animal what are the pharmaceutical enzymes which are extracted from the animal source, like trypsin, which is extracted from ox bile. Okay, chymotrypsin, which is also isolated from ox bile on pancreas. Lipases, it is also from the pancreas. Aliptases, which is the Chinese hamster. Okay, so this aliptase, it is one of the pharmaceutical enzyme which is extracted from the Chinese hamster. Then the urokinase, it is extracted from the human urine. Then the lysozyme, which is used from the hen eggs. Okay, then adenosine deaminase, which is used or adenosine deaminase, which is extracted from the bovine intestine. Then the pepsin, it is from the hound pancreas. Then the ribonuclease. Then doronase alpha, which is extracted from recombinant human cell. Urokinases, which is extracted from the human urine. Reptilases, which is isolated from the snake venom or Bothropus atrocus. So these are the certain pharmaceutical enzymes which are extracted from the animal source. Afterwards, there are certain pharmaceutical enzymes which are also extracted from the plant sources. that is the papain, which is from the Carica papaya, bromelain, which is extracted from Anas comosus, then amylase, which is extracted from the malted barley. Okay, nattokinesis, it is from the netto, it is one of the Chinese food. Okay, so these are the enzymes which are extracted from the plant. Then certain microbial enzymes, okay, which is also used as a pharmaceutical enzyme. In that, the bacteria and the fungi they are used, like L aspergillus, which is extracted from E. coli, collagenase, which is extracted from the Clostridium histolyticum, then streptokinesis, which is extracted from beta hemolytic streptococci, glutaminase, which is extracted from E. coli, rhodonase, which is extracted from sulfobacillus sibiricus, then staphylokinesis, which is extracted from the staphylococci species, beta lactamase, which is extracted from the staphylococci, serrapeptidase, which is extracted from the Serratia species, amylase, which is extracted from the bacillus. So these are the certain pharmaceutical enzyme. So maybe MCQ asks like the staphylococci kinase, it is extracted from staphylococci. Beta lactamase, it is from the also the staphylococci. Serrapeptidase, which is extracted from the Serratia. Okay, like this. Afterwards, the fungal sources like proteases, Serratia. Proteases, it is extracted from Serratia. Brinase, which is extracted from the Aspergillus oryzae. Lipases, which is extracted from the Aspergillus oryzae. Amylase from the Aspergillus, and uricase from the Candida utilis. Okay, so there are certain diseases they are treated with that pharmaceutical enzyme. Like one disease called as a Fabry disease. This Fabry disease, it is result due to the accumulation of fatty substances called as a globotrynosyl ceramidase, that is the GB3. This GB3, it get accumulated in the kidney, heart, nerve, blood vessel. Okay, so there is a accumulation of fatty substances, it is occur in that Fabry disease, and this Fabry disease, it get treated with one pharmaceutical enzyme called as a recombinant human galactosidase A. And when this recombinant human galactosidase A it is injected, it prevents the GB3 accumulation by breaking it down. So this Fabry disease कोणाला झाला असेल तर कुठला एन्झाईम दिला जातो, गॅलेक्टोसाइडेज. So galactosidase A, it prevent the accumulation of GB3 in that kidney. Okay, then afterwards, that is the Goucher disease. This Goucher disease, it is result due to the deficiency of an enzyme called as a glucocerebrosidase. Okay, so in Goucher disease there is a one enzyme it get deficient called as a glucocerebrosidase, and due to that it cause a lipid accumulation in the spleen, liver, and their subsequent and due to that lipid it get accumulated, it gets swell. So the enzyme glucocerebrosidase, it is used to treat that disease, and this glucocerebrosidase, it is derived from the human tissue, then it get purified and then chemically altered in order to target the cell with that lipid buildup. So Goucher disease, it is prevented by of one enzyme called as glucocerebrosidase. Okay, so afterwards, that is a certain thrombolytic enzymes are also present. This thrombolytic enzyme, it is also called as a fibrinolyticus. This fibrinolyticus, these drugs are used to lyse the thromboclot to recanalize the occluded blood vessels. They are curative rather than prophylactic, and it is act by activating the natural fibrinolytic system. So certain activators like streptokinase, urokinase, alactase, it is a recombinant enzyme. They are used to what? They are used to lyse the disease. Okay, so like here what happens, this plasminogen, it is present in your blood, and this plasminogen it is converted into the plasmin. Okay, so when this plasminogen it is converted into the plasmin, here what happens, this fibrin, it is a insoluble product. Okay, and when this streptokinase it is added, it gets solubilized. Okay, so this is what the certain thrombolytic enzymes which can prevent the blood clotting. Okay. Then again the streptokinase enzyme. The streptokinase enzyme is obtained from the beta hemolytic staphylococci group C organism or inactive as such. It combined with a circulating plasminogen to form an activator complex which then cause a limited proteolysis of other plasminogen molecules to plasmin. So to convert a plasminogen into the plasmin, the streptokinase enzyme it is used. It is used as an antigenic and it causes an hypersensitive reaction or anaphylactic reaction. Then again, another enzyme it is also used as a plasminogen or it can directly activate a plasminogen called as urocinases. This urocinases it is isolated from the human urine and it is now prepared by culture human kidney cell. Okay, so maybe MCQ asks that the urocinases it is isolated from, that is the culture human kidney cell, and it activate a plasminogen directly and it is a non-antigenic. Okay, so another enzyme which is we call as a nattokinase. This nattokinase it is extracted from traditional Japanese food. It is not a Chinese food, it is a Japanese food called natto. This natto it is a cheese-like food, and this natto it is produced from the fermentation processes by adding bacillus natto to the boiled soya bean, and it dissolve directly fibrin. Okay, so it also enhances the body production of plasmin and it is taken orally. It is generally take 100 mg per day. Okay, so this is what the various application of various application of pharmaceutical enzyme. There are also the oral and inhalable therapies are available like saccharosidase enzyme. It is a beta fructofuranidase enzyme. Okay, so it is a beta fructohydrolase enzyme which is extracted from Saccharomyces cerevisiae. So it is what? A beta fructohydrolase enzyme. So it is extracted from Saccharomyces cerevisiae. Saccharomyces cerevisiae it is a yeast and it is taken orally to treat a congenital sucrases isomaltase deficiency, that is the SIDS, CSID, that is the congenital sucrases isomaltase. It hydrolyzes the sucrose allowing the consumption of more normal diet. Okay, so सपोज सुक्रोजला हायड्रोलाइज करायचं असेल तर सुक्रोसाइडेज दिला जातो. ठीक आहे. देन फिनिलेज, दिस फिनिलेज एन्झाईम इट इज अगेन द रिकॉम्बिनंट एन्झाईम. सो इट इज अ रिकॉम्बिनंट ईस्ट phenylalanine aminolase enzyme and it is used to treatment of phenylketonuria. Okay, so it is used for the treatment of phenylketonuria, that is a PKU, which caused due to the deficiency of phenylalanine hydroxylase. This phenyl deficiency असते, phenylalanine हायड्रॉक्झिलेजची डिफिशियन्सी असते, म्हणून डायरेक्टली काय दिलं जातं, फिनिलॅलेनिन हायड्रॉक्झिलेजची डिफिशियन्सी असल्यामुळे फिनिलकेटोयुरिया डिसीज होईल. ओके, आणि हा फिनिलॅलेनिन हायड्रॉक्झिलेज कशाला लागतो, हा फिनिलॅलेनिनला कन्वर्ट करतो टायरोसिनमध्ये, आणि जेव्हा तो फिनिलॅलेनिनला कन्वर्ट करणारे टायरोसिनमध्ये तेव्हा इट इज रिक्वायर्ड. ओके, अँड फिनिलकेटोयुरिया हा होतो डिफिशियन्सीमुळे, आणि हा फिनिलकेटोयुरियाला प्रिव्हेंट करण्याकरता एन्झाईम दिला जातो, फार्मास्युटिकल एन्झाईम, त्याला म्हटलं जातं फिनिलॅलेनिन अमोनियालाइज. ओके, सो दिस इज अबाउट व्हॉट द फार्मास्युटिकल एन्झाईम. सो तुम्हाला कुठले कुठले बघितले, दॅट इज द सुक्रोसाइडेज अँड फिनिलिनलाइज, नेटोकायनेजेस, देन स्ट्रेप्टोकायनेजेस अँड युरोकायनेजेस, thrombolytic drugs, that in that we see the streptokinases, aliptases, urocinases. then the Gucher disease मध्ये glucocerebrosidase, Fabry disease मध्ये कुठला आहे, that is the galactosidase A. So you have to remember all these the enzymes and what are the sources and where it is used. Okay, so here we